My husband's facial spasms began about 15 years ago, and he visited one of the local hospitals in Murfreesboro for treatment, and they told us they thought he may have had a mini stroke, but they thought the facial spasms were actually happening because he needed rest. About 6 years ago, we met a friend who had hemifacial spasms, but we did not know because she was already doing Botox treatments. But she noticed Joe's facial spasms and she approached us about treatment.
Mr. Spradley had a typical course of hemifacial spasm. He initially began experiencing the twitching around the eye. It pretty rapidly progressed in his case to involve really the whole side of his face, began interfering with his ability to drive.
One bad thing about it is like she was saying, that it did close my eye, but I was working at nighttime, and one of the bad part about it is I was driving to work, and of course, you see two lights coming towards you from the other car. Well, I would see four. I got to the point that I was kind of scared driving at nighttime, till this stuff wore off.
The first line of treatment for hemifacial spasm is injection of something called Botox. You've probably heard of Botox being used for cosmetic purposes. Given a little deeper and a little different areas, it can actually relax these muscles as they're twitching and contracting. Hemifacial spasm typically starts as small contractions in the muscles around the eye. It can then become progressive over time, where it begins to recruit more and more of the muscles on one side of the face. It can get to the point where the contractions become constant, and he just wanted something that was more of a permanent fix, that he wouldn't have to go and get those injections every 3 months. The surgery for hemifacial spasm is called microvascular decompression. And so basically what we're doing is making an opening to allow us to gain access to the area where the nerves are coming from the brain and going to the face. So the surgery is actually going in and separating the artery from the nerve.
I searched for a while trying to find a physician that would do treatment for him, and that's where I found Dr. Ohm's website page. And so I called them and got an appointment. We got in just almost immediately, within a week. So it was a very good experience there. Everyone here was wonderful. And we were in surgery in 2 to 3 weeks.
Yeah, it was in 2 weeks, and once I come out, I've had no spasms at all.
We honestly are surprised at the outcome because he has had 0 spasms since surgery. None.
I feel that patients with hemifacial spasm should be empowered to come and sit and talk with us about the pros and cons of surgery. Certainly considering any kind of surgery around the brain is scary, and we'd be happy to sit and talk with them at length about the pros and cons.
I'd say anybody that would at least look into it. That'd be my suggestion on it. It's just, it's a miracle. That's all I can say.